Welcome to the Autoimmune Doc podcast. As always, this is your host, Dr. Taylor Krick, and I love breaking down the concepts and the mechanisms behind chronic and complex health conditions. And joining me today is Dr. Izabella Wentz, who is no stranger to me and needs no introduction to me as far as, in the world of functional wellness. She's a very well-known name because she's got several great New York Times best-selling books and Wall Street Journal best-selling books. And she's also got a new book coming out that we're going to talk about today. But the biggest thing I would say, Dr. Wentz, is Hashimoto's. That's kind of your background and your kind of part of your health journey too. And, same with me as well. That's kind of what got me into autoimmunity. And my story is different than yours, because I always say mine was kind of a diagnosis of luck, maybe bad luck, but just I wasn't really struggling. I wasn't really suffering. I was just running routine labs and found that I had Hashimoto's antibodies and started learning about autoimmune, started seeing more autoimmune, started studying everything I could find about autoimmune. That's what led me to, some of your, books and member groups on Facebook and things like that too. So welcome to the show, Dr. Wentz.
Dr. Taylor, thank you so much for having me. What an honor to be here with you.
So I mentioned this and didn't want to keep rambling, but your background was in Hashimoto's, and I'll say this too. Your new book is about IBS, so I really want to pick your brain about gut health. And gut health is something that if you're a listener to the podcast, you're no stranger to the topic of gut health. But tell us a little bit about your health journey and just even whether it's your own health symptoms, and then also just the evolution of your career too, because you've got the books that have been blown up, and I would also say too, you got your IBS book, adrenal book, and your thyroid books, and your food books too. And it's like, boy, what 4 things do people need more than those 4 books? You know what I mean? Like, that is like, you're covering your bases. Your next book will need to be about toxins, and then you've got it all kind of checked off there, Dr. Wentz. But tell us about kind of your journey, health-wise.
Well, I wasn't always interested in the thyroid or IBS during pharmacy school or high school or undergrad or anything, but I always knew that I wanted to help people with their health, and I was fascinated with medications and how one pill could really transform a person's life. Imagine taking one pill and then blood pressure in your entire body drops, right? Or you take another type of maybe hallucinogen or something, and all of a sudden you're seeing pink horses running across in front of you. And I just thought this was really fascinating. And so I decided to study pharmacy. And before pharmacy school, I had to do my pre-pharmacy coursework and undergraduate studies. And actually during my first year of undergrad, I started to, I just started to have this awful fatigue. It just kind of came out of nowhere. I mean, I thought it came out of nowhere. I can reflect back on that and say like it was my lifestyle and a lot of the drama of being 18 that probably caused that chronic fatigue and all of my symptoms. And then as time went on, I began to have like a slow breakdown of health. I started with the fatigue and some anxiety, some mood issues that progressed where during pharmacy school, I started to have irritable bowel syndrome. And then as time went on, I started to have acid reflux, panic attacks, anxiety attacks, hair loss, carpal tunnel. And it just was like almost every other few months, I was starting to get new health symptoms. And I felt
just
like
the number just kept growing, it sounds like.
right. I was collecting so many diagnoses. I was going to like the cardiologist, the gastroenterologist, the allergist, the immunologist, the dermatologist, having, my heart checked, having somebody prescribe medications for carpal tunnel, proton pump inhibitors. All the meanwhile, I was in my 20s and I was just exhausted, sleeping for 12 hours a night. And it just was like, okay, I was already a practicing pharmacist at that time, and I'm going to the left-hand doctor and the right-hand doctor. They're all telling me different things. I'm not really getting any answers. And it was actually, being a Leo, it was my hair loss that was like, we're got to figure this out.
That's an incredibly motivating symptom. People can be tired, they can be sluggish, they can be constipated, but you start losing their hair, and they're searching for an answer, right?
I think so. I think as a young woman, it was easy for people to tell me that it was normal to gain weight and to be tired, and all of these things were part of the normal aging process, but I was like, no, not my hair. That's just not normal, right? Like I just knew it wasn't normal for my hair to be falling out. And so I was eventually diagnosed with Hashimoto's, really high thyroid antibodies, and subclinical hypothyroidism. Being a pharmacist, I was like, woohoo, medications, here I come, right? But the medications only helped a little bit. So I slept instead of 12 hours a night, 11 hours a night, and I needed like one less jacket. But I was still experiencing all the other symptoms, right? And I was like, okay, but I still have all these gut issues and so on and so forth. And at that point, I was like, I wonder what I did to develop this condition. Could it be lifestyle induced? Could I do anything to make myself feel human again? Am I destined to feel like this forever? And can I reverse any of this? And that's sort of how I became a Hashimoto's thyroid expert, really being my own guinea pig, trying to find solutions that worked. And throughout the process, I also eliminated irritable bowel syndrome, acid reflux, carpal tunnel, hair loss, anxiety, panic attacks. All of these I was able to vanquish. And also, did I say carpal tunnel? Because yeah, that carpal tunnel, I couldn't write, I couldn't do yoga or do any of the fun things that I like doing.
Yeah, well, and you said, because I know a little bit about your IBS book, that your IBS maybe preceded your Hashimoto's, but that's not the way you uncovered it. You uncovered the Hashimoto's as far as the, explaining some of your symptoms, but then in the when you got over that, it ended up getting over your IBS symptoms as well too, right? And so everything kind of went away and improved, I guess, after that.
Well, it's interesting because I got my IBS diagnosis during pharmacy school, and then a few years down the road, when I graduated from pharmacy school, I got the Hashimoto's diagnosis. And when I was going through functional medicine training, one of the things that was mentioned at an IFM conference is that an IBS diagnosis oftentimes precedes an autoimmune diagnosis. And we can kind of get into why that is. It's like one sets the seeds for the other to happen. And part of my healing journey, the first thing that actually went away was the acid reflux, bloating, and IBS. So getting off of inflammatory foods, I was like, wow, this is making a difference. I had been really into working out, but I always had this belly, and I was like, what is going on here? Right. And then all of a sudden, within 3 days of eliminating the foods, I'm like, oh, I have abs. Where do they come from? And I didn't need my proton pump inhibitors. I didn't need my Pepsid and my Tums. I was taking like boatloads of acid suppressing medications on a regular basis. And, at work, the bathroom was like my second office because of my digestive issues.
Well, let me say this again too, because I think it segues to talking more about IBS. But you found your Hashimoto's, and you medicated your thyroid, and maybe your thyroid levels were normal, right dosage, right, levels, but you still didn't feel well. And I think that's to say that's the rest of the autoimmune process. You got the right hormone levels, which we can do through medication, but there's still this inflammatory autoimmune process going on, and you still didn't feel well. And then as part of that, the gut is a gateway to autoimmune conditions. So as you just said, what would you say, 5 to 15 years, IBS will precede autoimmune diagnosis, or whatever the stats were you just said. But that was all part of your autoimmune journey and why you didn't feel well even once you got your thyroid under control. So tell us a little bit about IBS, Dr. Wentz. And I mean that, and let me tell you my thought of it. I told you this off air a little bit. The diagnosis is a little bit like you could get an IBS diagnosis because your bowels are irritable. And most people, they know their bowels are irritable. So they're like, thanks for a news flash. I know my bowels are irritable. So I think IBS is a very broad diagnosis that a lot of people can fit into, but also not everybody has been given that name or diagnosis. But talk about IBS as a diagnosis, and then whatever else you want to say with regards to gut health, because not everybody with IBS is going to be on PPIs. Not everybody with IBS is going to have diarrhea or constipation. It's going to be some collection of these symptoms gut wise. And it's like, oh, yeah, my bowels are irritable. But talk about that diagnosis and just how, I don't know, maybe how prevalent you think it is. But in my mind, too, it's hard to keep rambling, but people come into me with inflammatory autoimmune conditions. I'm looking at the gut every single time. But I think that's because I'm trained to look at the gut because that's what the literature suggests, and that's what books like yours have suggested. You know, you read 5 autoimmune books, they're all going to say, "Look at the gut, look at the gut, look at the gut, look at the gut, look at the gut." So that's been pounded into my head. But talk about gut health and IBS as kind of the gateway to autoimmune and inflammatory conditions, and tell us about what you mean by that.
Yeah, so definitely we know that there's a connection between gut health and autoimmune. Dr. Alessio Fasano has stated that there needs to be three things in order for autoimmunity to be present. And the first one is the genetic predisposition, but genes are not our destiny, right? And so you also need a triggering event, and then you also need intestinal permeability in order to be present. Now, let's say a condition like Hashimoto's, if it was purely genetic, if one identical twin had Hashimoto's, then the other one would too. That's not the case. It's about 50-50, right? If one twin has Hashimoto's, there's about 50% chance that your other twin will as well. And so the triggers and the intestinal permeability is where it comes in. I grew up in Poland, close to the Ukrainian border, and Chernobyl was a huge nuclear fallout event that led to a lot of thyroid disease, thyroid cancer, also Hashimoto's, right? And thyroid nodules. And you can see the perimeter around where I guess the people were downwind from all of that radioactive fallout. You have much higher rates of Hashimoto's and thyroid antibodies than you would in a different part of Ukraine that was, genetically very similar, right? You can't say necessarily that just the Ukrainians downwind from the nuclear fallout were just genetically altered, right? It was this trigger that kind of brought this out. And then the third piece of the puzzle is that intestinal permeability. So when we have intestinal permeability, also known as leaky gut, then our immune system can't properly manage what's us versus what's foreign, and that can launch an attack against our own organs, against foods that we're eating, and so on and so forth. And the beauty of it is that we can't really change our genes these days. We don't always know the trigger, and we can't always eliminate the trigger, but we can always figure out on how to improve our gut health. And this is where, there's an overlap with intestinal permeability and IBS. People say, like, what does that they have to do with each other? Well, there's a chance if you have IBS, especially IBS diarrhea, that you have intestinal permeability, because it can be asymptomatic, or the most common symptoms of intestinal permeability are actually going to be IBS symptoms. And, we can talk about the IBS diagnosis, what I think about it. I think it's kind of a trash diagnosis. It's like a wastebasket diagnosis. It's done by clinical report. So basically a patient comes into the office and tells the doctor, I have diarrhea and constipation. I've had it for X amount of time. And, or, I have one or the other, or they're alternating, and I have stomach aches. And then it's like, okay, we're going to give you the IBS stamp. It doesn't tell us what caused it. It doesn't even tell us what to do about it, because there's 20 plus different causes of IBS. 98% of them, at least in my opinion, are going to be treatable causes, but the treatments vary depending on the cause. And yet conventional medicine approach is like everybody gets the same thing, whether that's, oh, fiber, you need more fiber. Guess what? If you have SIBO, fiber is going to make you feel worse. Or, you can get this probiotic for your symptoms, but that's not going to do you much good if you have celiac disease to take probiotics. And so there's a lot of different root causes that lead to you having IBS symptoms. And my goal is to raise awareness about what those causes are, because when you know the cause, you can figure out the right treatment protocol.
Exactly. I say that all the time. And that's again where, testing comes into play, and just looking at the gut and looking at the microbiome and saying, well, what do we need to do? We know where somebody comes in with gut symptoms, we're trying to solve a gut problem. But what do we need to do to solve that problem? As you said, sometimes we need to plant seeds with probiotics. Sometimes we don't. Sometimes we need to pull weeds and kill off bugs. But that's well said too. But you got to look at it and see. So what is the standard of care for IBS? Because, again, you said blood pressure earlier. It's like amazing that you could take one pill and it lowers your blood pressure. Well, that's pretty, obviously it's sometimes complicated, but it's pretty easy. You got a problem and here's the diagnosis and here's the solution. But with gut things, it's not nearly that clear. And they use, again, we've already kind of pointed at some of these, but they'll use PPIs and they'll use, Miralax. And if it ain't those two, they're running out of answers. What's the typical standard of care? And let's also say too, because let's say somebody has an endoscopy or a colonoscopy and they're like, good news, you don't have Crohn's or colitis. Then they have even fewer answers. What is the standard of care, the traditional, timeline that people are going to go through if they go through the conventional care?
Well, gosh, it is going to be something like, okay, you come into the office and you talk about your symptoms. Most of the time, if you go to a primary care doctor, you're not going to get any testing done. You're just going to be given a label. I do advocate for working with a gastroenterologist and getting scoped, especially if you have red flag symptoms like bleeding. This can indicate colon cancer. This can indicate Crohn's, colitis, right? And so the treatment approaches for those are going to be much different depending on what you would do for, let's say, SIBO caused IBS, whether that's conventional or functional medicine. But the conventional approach is like, you've got this IBS label, so you can try a medication. There are some prescription options. There are some over-the-counter options depending if you've got diarrhea or constipation. Maybe you can reduce your stress. Never a bad idea. Also, never really a complete solution, right? And then maybe fiber or probiotics, some kind of OTC recommendations might be a part of the recommended list of things you can try. But really, the sad thing is less than 25% of people feel relief over the course of 6 years with this conventional approach. In 2011, Dr. Haba, a gastroenterologist, found 98% of his 303 patients with IBS had some kind of a treatable cause of IBS, which means like you find out what it is, you give them the right treatment, voila, they no longer have IBS. But most people are not getting that kind of a workup done. And I would argue even to say that there are many other causes that he talked about, celiac disease and bile acid malabsorption as being two of the common causes. Celiac disease can account for 25% of cases of IBS, but we have a lot of potential causes, and so we just need to figure them out.
Yeah. What are your, in your book or things personally, what are some of your, favorite tools? Like I know food sensitivity testing is on the list, but what else as far as stool testing or other things? I mean, that might be the answer, but tell me about what your favorite tools are, or if you, whether it's in the book or not, if you get into, because, in clinical practice, it's like, what's your favorite, and I hate asking that because I always say Ford says they're better than Chevy, says they're better than Toyota. There's a lot of good labs out there, but what are some of the best labs in general? And then if you have any specific brands or labs that you like to use, feel free to drop them in here, but otherwise no pressure to. But what should people be looking at for this? Or is it a nuanced, customized approach based on symptoms? But what are your favorite, tools, I would say?
I would say like symptoms can be deceiving because, you can have IBS symptoms. You could be constipated for a bunch of different reasons. You can have diarrhea for a bunch of different reasons. So if somebody has done like an elimination diet and has already tried digestive enzymes, is eating pretty clean, which I don't know about you, but by the time a lot of people reach me, they are already pretty much eating a better diet than I am and still having symptoms.
100%. And they've got a duffel bag full of supplements and they've tried a bunch of stuff usually. Yeah.
Yeah, absolutely. And I'm like, wow, like you put me to shame. But the thing I would do in that case is I would really tailor through precision medicine and looking at some functional lab testing. I really like the IgG food sensitivity test from Additives lab. I found that to correlate pretty well with like acid reflux and digestive symptoms, where other labs I've done or I've seen, and it would be like, you're sensitive to corn, and the people would be like, I didn't notice any difference going off of corn. Whereas with this test, if it says you're sensitive to corn, they would get off of the corn and they'd be like, wow, my rashes went away. And, I don't have that weird burpy thing anymore. So that would be one of the favorites. Second favorite is going to be a comprehensive stool analysis. And I kind of, it's like picking a favorite child. Sometimes it's hard, right? I go through different iterations where I'm like, this is my test, this is my test. And right now I'm loving the gut zoomer test. And the reason for that is because I'm finding more infections on it. So a lot of the root causes for many people with Hashimoto's and autoimmunity and IBS, the protozoal parasites are just really underappreciated. One study found, I think 73% of people with IBS had blastocystis hominis. And there's a lot of stool tests out there that I've done on my clients and my poor family members. And sometimes I would be like, you've got so many symptoms, and this stool test said, your gut is perfect, or maybe you just need some enzymes. And I would kind of be scratching my head, like, I really am not getting any information from this. And then I would do a gut zoomer, and I would be like, wow, you have Endolimax nana, or wow, you have
Hmm.
Entomoeba histolytica, or oh, yep, there's blasto. And so I feel like it is one of those tests that is, at the time of our interview, giving me some results. And
Yeah,
that's always encouraging.
and I completely agree. The best test is the one that gives you the answers. And some of them, if they don't give you the answers, it doesn't mean it's the wrong test. It's just the wrong test for the problem you're trying to solve because it didn't give you the answers. But so I don't do a lot of gut zoomers, quite frankly. I do every lab and I do vibrant tests. But just the fact that you said that, it might move up my, ordering volume because I've seen some really tricky blasto cases and I've seen some people that are really symptomatic that have had it show up three, four stool tests in a row. And it's like, boy, this thing is really difficult to eradicate in some cases. Sometimes it's really easy. Sometimes you take some Sac B and some, uh, herbal antimicrobials, and the symptoms improve and the labs improve too. So it's like, I think we got it. But it's sometimes really, really tricky in some of the cases. I know even you and I don't know if you'd even remember this, but we've emailed about one of the cases that was like really, 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 really tricky. And I've had multiple like that were just like three, four, five stool tests in a row. But the gut zoomer is going to be high on my radar now. What about some other, tools? I don't want to be again too general with this, Dr. Wentz, but like, and I know we're jumping around a little bit, but let's say somebody comes to you or with gut issues, what's the starting point, let's say? Because in my practice, and I only want to say this just to say what I do, and then you can tell what you do, but it's like first we'll talk about symptoms. And then that's going to guide us towards testing because I don't always do everything. So we might do a stool test, we might do a foods test, like you mentioned. We might be looking at intestinal permeability. That's a common one that I'll look at, occlusions and zonulins. But we're also at the same time, while we're waiting for the labs to get back, they're changing their diet, they're trying to change their food. So again, I don't know, I'm backtracking a little bit of my questions, but like, what's the order of operations if somebody comes to you, whether they've been five people before or they haven't? What do you think is the right order of operations, with treating a gut condition?
Yeah, with treating a gut condition or a thyroid condition, I would definitely start with going through what their current symptoms are, doing a comprehensive intake, and then we go through, kind of think about like what's really coming up for you. If I see that they are having like frequent urination and joint pain and not sleeping at night, I might be thinking like candida, oxalates, or mold. So I might recommend like an organic acid test or a mycotoxins test. If they're having a lot of symptoms of like impaired detox, then I would recommend liver support. I really kind of, I have my thing that I do with just about everybody. There's like six categories of things. Might choose where to start first with a
Ex-
particular person because I
Yeah.
don't want to overwhelm them and be like, here, take everything.
Yeah.
And so, if their digestive symptoms are really the bigger thing, then I would start with an elimination diet. If they haven't done one already, then we would get on some um, P5P or B6 to help them tolerate more things. Then I would consider doing things like Saccharomyces boulardii to help their gut immune function. So that can help, like you talked about, that can help with overcoming a whole bunch of different infections. We do know that people with mold exposure can have a suppressed gut immune barrier. So low secretory IgA levels typically make you more likely to have more food reactions and catch more infections and not fight them. So I would do usually something like that to help raise immunity. If they have constipation, I might consider something like magnesium citrate and carnitine to help move things along. If they have diarrhea, I might be looking at potentially doing some zinc and L-glutamine, again, tailoring it to their particular symptoms.
Well, and that's what I'm hearing too, because I get asked these questions a lot, and I'm like, that's so hard to answer because it's exclusively based on the person in front of me, and it's never the same two things. I mean, not like I don't repeat things, but it's like, what do you need, and what have you done, and what hasn't worked, and what do I think is going on, and if we want the bowels to be moving more, then we're going to do things to try to get them moving more. If we want them to be moving less, we're going to do some things to try to get them moving less. But it's nuanced. I think that's a word that has come up so often in my latest few podcasts is like, if you ask me what is somebody with Hashimoto's going to get in your practice, I'm like, I don't know. It's going to be, what does that person need? And I don't have a cookie cutter answer for that. And that's what I'm hearing from you too, is it's like in these 6 categories, we're asking them and we're fitting them into what I think they need. And it's never the same thing for every single person. Would you agree with that?
Yeah, absolutely, because everybody might have like a different pattern of root causes. Like I always see patterns whenever I do intakes and I talk to people, but there might be different supplements they can tolerate, or somebody might not swallow pills, right? So I'll be like, okay, there goes my idea for
Exactly.
this
Yeah.
protocol.
Liquids, powders. Yeah.
Yeah, so I always tailor it. And, kind of going back to what you said about blasto, so there's a lot of different subtypes of it, and some of them are more treatment resistant. And so I wish there were tests to kind of differentiate that out, but I haven't really, I think they're more like research, available research than clinically. So then I'd be thinking about, okay, if you have had this and you've had it a few times, what are we going to do? And we could utilize things like pancreatic enzymes to something that contains lipase to help break down the lipid layer of the blasto. We can think about potentially longer courses of treatment, or covering enough life cycles, maybe doing something like Alinea, the medication that can help with it. And also looking at, like, if you're mold exposed, then your immune system is going to be suppressed and you're just not going to be able to fight anything. Everything's just going to be really thriving in your intestines that you don't want to thrive, and all the good bacteria are going to be suppressed.
Yeah, I'm for the sake of the listeners, I'm not going to tell you about some of the cases that are spinning in my head, but I've got a couple that are like so tricky blasto wise. And I'll tell you two of them, the two trickiest that I've ever seen blasto wise, they're completely different. One of them's a raw dairy farmer. They live on a farm. They're exposed to farm animals. And he's like, I've been milking cattle since I was 8 years old, and so mold is on the radar, all these chemicals are on the radar, all these things, they are organic. But the other one is very, very different. He's a basketball coach. He travels all the time, so he's never in the same place. It's like not mold related. So anyway, just very intriguing. But lab testing wise, this blasto has shown up number of times and has just been very difficult to eradicate. And we've done like all the things that are famous and out there, but all these things are things that we're considering. Is like, well, why have we not been able to get this? Tell me. Let me ask you this. Tell me about SIBO. Now, I know that sentence is like, where do I begin? But SIBO versus IBS, similar, the acronyms can get confusing for people too, but SIBO is small intestinal bacterial overgrowth. Now, also for me, Dr. Wentz, whenever I talk about SIBO, I'm like, what about SIFO? Because antibiotics might address the BO, the bacterial overgrowth, but they might not address the fungal overgrowth. But tell me about SIBO and just prevalence of that. I don't mean like statistically like in America. I mean like in your opinion, how often do we see that? Or if somebody's, bloated or some of those things. And one of the other things I'll say about SIBO too, sorry to keep going, but a lot of the gut things, probiotics, fiber, bone broth, whatever might light somebody up with SIBO. So that's a lot of times the people that come into our practices is like, boy, I've tried everything and it made me worse. Tell me about SIBO and how that's differentiated or similar to IBS.
Yeah, SIBO can be a very powerful driver of IBS. And like you said, a lot of times people will do all the internet famous things for their gut health. For example, they will drink bone broth and then they'll have a histamine reaction to that. Or they'll take probiotics or fermented foods and all of these like things that are so wonderful for your gut, fiber, right? And what happens is they end up feeling worse with it. So SIBO, the bacteria, that grow in our small intestine are generally going to be considered, I guess, pathogenic or opportunistic. Like basically, we're not supposed to have bacteria there.
Yeah, there's a
So
lot
they're like
less.
displaced, right? They could
Yeah, it's
be.
not completely sterile, but there's very few bacteria in the small intestine. Yeah.
So essentially, like you could have lactobacillus bacteria, like probiotic bacteria, and they could still be causing you reactions when you take them as probiotics if you have SIBO. And so the interesting thing when I was first studying functional medicine, I thought every case of IBS was caused by SIBO. It is kind of common to have SIBO when you have IBS, but it's actually like not necessarily always the be all end all. It might be something that is part of the presentation. Let's say somebody's hypothyroid, that might slow down their motility. And so rather than the bacteria passing through like they should be, they can take up residence in the small intestine. If somebody has like a parasitic infection in their large intestine, that can potentially impact the valve, and that can cause people to have the bacteria again getting in there. And then somebody has something like H. pylori or low stomach acid, then the bacteria might not get properly deactivated and they can cause SIBO again. So there's a lot of times there's a lot of different things we need to think about when somebody has SIBO. The standard approach is like you have SIBO, so take some medications or herbs to clear out the SIBO, and that can work, but oftentimes you have to fix the other things around it. And the other issue that I typically see with it is the low FODMAP diet. A lot of times people think that that is the cure for it, and even like a lot of naturally minded people, they're like, oh yeah, I want to do diet because it's better than medications or it's better than X, Y, and Z. But the FODMAP diet, the low FODMAP diet, basically means the bacteria are not going to be producing the offensive gases that exacerbate your symptoms, but the bacteria are still going to be there. Like you're not going to starve them. And so people end up on this low FODMAP diet, which is restrictive, and you get rid of foods that have benefits like, artichokes and onions and some of these really good foods for the microbiome.
Yeah, the resistant starches and the high fibrous vegetables and things. Yeah, they're good, but yeah.
Yeah, and they end up essentially really messing up their gut diversity without really treating the problem. And so I feel like I actually have a chapter on SIBO and SIFO for that reason, on how to properly care for it. And you would want to do a breath test for it. Stool tests won't find it. And then once you get the breath test, there's different types of SIBO, so you'll have to do a different protocol. And after you finish the protocol, you also have to retest, because sometimes it's like, I think of SIBO as like having hair. You can have a lot of hair and you cut it and you still have hair, right? So you have to completely shave it down, because sometimes you might kill off a little bit of the SIBO, but you still have a lot of it left. It might be 50% gone, but you're still going to be symptomatic. And SIBO is one of the most powerful inducers of intestinal permeability.
Yeah, I completely agree. And I've also seen people, I'm sure you have too, where they fail a breath test, but their stool test shows they've got low probiotics or low bacteria. So those two things are not the same. As you're saying, what you're measuring in the stool test is not always what's seen on the breath test. And then you could have hydrogen, you could have methane. Sometimes it won't resolve, but the stool testing will, or different things will change at different paces and times. So and it's a really just, again, I don't want to say nuanced again, but it's a nuanced conversation. And then to your point too of like, the FODMAPs might be pouring fuel on the fire. So stopping pouring fuel on the fire doesn't put the fire out. You got to put the fire out, but you could stop pouring fuel on it just for your own misery, so you're not feeling as miserable and as bloated and things like that. But you got to do some things to put that fire out. And I always say too, and again, I know I'm interviewing you, you're not interviewing me, but the four things I always say, besides killing it, you got to kill it. But you got to get the vagus nerve and the thyroid working, because you got to get motility and that gut brain connection and stomach acid and all those things. So that's the gut brain and all those things starting point. But then you got to have good stomach acid. You got to have good bile from the gallbladder and liver, and you got to have good digestive enzymes, because those all help neutralize that bacteria too and keep that bacteria, that small intestine fairly sterile. And that's where a lot of our absorption happens, and where a lot of, that leaky gut, you see like the online drawings of leaky gut. A lot of times that is in the small intestine where there's not as much bacteria. But yeah, so SIBO, a pretty interesting thing. And it's a massively important, practice wise. And there's a relationship with it too, with thyroid. But let me ask about the next thing I was going to ask about. I'm tempted to ask about that, but I was going to ask about IBD because I know you've had a personal story with your husband with IBD, and IBS and IBD very often confused, and then SIBO, another acronym. It's like, boy, this is a lot of I's and S's and things like that. But what's the difference between IBD and IBS as far as I don't know, it's further down the spectrum, or what's just the difference, or what's maybe even some of your personal story with that?
Yeah, so a lot of times IBS and IBD might have some similar symptoms and overlap with digestive issues, but I would say IBD, the way that it's been described, is more of a structural issue. So there is actually like damage and inflammation in the small intestine or in the intestines. And so when somebody were to do a scope endoscopy or colonoscopy or whatnot for with IBS, there wouldn't be any kind of changes that are associated with it. But if they were to do, let's say, a colonoscopy for somebody with something like ulcerative colitis, they would see ulcers in their gut. And so this is something that can be more serious as far as you might lose your colon. You might have people have their colon surgically removed. I would say the symptoms are more severe. They're more at risk for cancer and so on and so forth. So it's important to know the difference. I would say about 10 to 15% of people who have IBD get misdiagnosed with IBS. So I've met a lot of people over the years where they're like, "Oh yeah, I've just had really bad IBS. I've had really bad IBS." And then I've been like, "Are you sure it's IBS actually? Because I don't think this is a hemorrhoid. I think if you're having blood in your stools, you're losing weight, you're having like fevers and temperatures, this is going to be a red flag that it might actually be inflammatory bowel disease." And sure enough, they've been diagnosed with that. And the treatment approach needs to differ, whether you're using conventional medicine or even functional medicine. Some of the functional medicine things we would do for a person with, like, let's say SIBO or IBS with caused by protozoa or something like that, are going to be entirely different. I'll give you an example, like using high dose berberine. I like to use that for SIBO or protozoa, but it can make inflammatory bowel disease worse. So that can cause more bleeding. Same with like some super high dose probiotics. They can produce too much inflammation with IBD. And so I kind of learned about IBD the hard way, because after the birth of my son, my husband was actually diagnosed with IBD 2 weeks later. I was going into labor and he's like, "I'm having, some bleeding when I go to the bathroom." And I was like, "Oh, sympathy pains, right?" Like, and I was like, I can't bother with
Tough
you
luck,
right now.
buddy.
Yeah, I'm like, "Good luck with that. Like, I've got, something else to do right now." And we were chatting earlier about why I have a 7-year age gap between my two children. That's one of the reasons. But so we went in for a colonoscopy when my son was 2 weeks old, because my husband just was having some really awful symptoms, and he was losing weight, and he just really wasn't himself. Like, he used to wake up at 5 a.m. and like run marathons and run circles around me, and he ran like 100 miles in like the Canadian death race. He's been like an extreme athlete, and I was like a sluggish thyroid patient, like I was like a sleepy cat. But all of a sudden I'm like, we have this new baby, and I'm like taking care of the baby all around the clock, and my husband's like crawling out of bed at 1 p.m. saying he was tired, right? And I was like, this is not happening. But we were thankfully able to get the right diagnosis and get him into remission within a couple of months. We were very fortunate to have Jill Carnahan, Debbie Steinbach, and Steve Wright, 3 of our dear friends in Boulder, that helped us develop a plan on how to get IBD into remission. And I also happened to go to like an IFM gut training like while I was pregnant. And so the IBS book has a whole chapter on inflammatory bowel disease. and how to get that into remission. Because I've seen so many people suffer for many, many years. Things like for him, food additives were a really big deal. Erythritol was really inflammatory. I know Michael and I, my husband and I, we love the keto diet, and I personally feel really great when I'm keto, and he has too. But Costco had these keto snacks that were sweetened with erythritol, and that was very much inflammatory for him and a lot of people with IBS and gut issues. The food additives, the artificial, the sugars, the
And
or
those sugar alcohols are typically touted as being healthier, like don't spike your glycemic, don't spike your insulin, things like that. But sorry, I jumped in on you, but yeah.
no, you did because I was calling them sugars and I meant to say sugar
But
alcohols.
I knew what you meant. You called them additives. You were accurate. I don't think you said, but you called them additives. But I agree. But they're a problem for a lot of people's guts. Just they might be benign for their blood sugar. Their blood sugar doesn't spike as much or things like that. But they can wreck guts.
They can act as osmotic laxatives when you have too many of them. So the Haribo gummy bears, a few years ago, they replaced sugar with like a non-caloric sweetener, and a lot of people ate too many gummy bears in one sitting and ended up finding out the hard way how these sweeteners can turn into like really explosive diarrhea, and they were calling it like the Haribo gummy bear cleanse. And there was a whole bunch of reviews on Amazon of people saying like things came out that they hadn't seen since the 90s. But just again, this is like if you have a lot of those non-caloric sweeteners, they can act that way. But for some people, even tiny, tiny amounts of them can produce a lot of gut irritation.
Well, and
So
even if somebody came to me and they were like, I get diarrhea after eating gummy bears, my first thought would probably be the food dyes or not the sugar alcohols or the non-sugar sweetener. It'd be an additive probably, but it's just like the list of additives is long, and toxins, are toxic for a reason. That's why they're called toxins. But that's an interesting one that you guys, circled in on as far as for your husband's triggers.
yeah, yeah. And then definitely there's like treatment approaches. So he had some other triggers too, including some infections. He did used to go camping and hiking and stuff in the woods. So there's all kinds of fun things you can pick up there. The other things that I feel like are really relevant for IBD are going to be essentially just really trying to lower the inflammation. We were able to utilize like high dose turmeric, Boswellia, serum-based immunoglobulins, and a partial elemental diet to really reduce that inflammatory process. He grew up in mostly Texas, so he's a big Mexican food person, but he couldn't eat like chips or tacos or anything crunchy. He had to eat like soups and squishy and mushy food to really help to soothe his gut lining. A lot of mucilaginous herbs, and kind of that did the trick. These days, he eats whatever he wants. I'm still gluten free, but he can eat pretty much anything, and he's been in remission for more than 7 years now. We did have a few flare-ups in the initial beginning where we were trying to figure stuff out, but I'm really hopeful to get this information out into the world because I see so many people suffering.
Well, in my opinion, being a little more general, it's like gut issues. Some people have none. But as you go down the spectrum, it's like, oh, I got a little bit of bloating, I got a little bit of indigestion, I got a little bit of this, and that might be IBS. And as the symptoms go up, it's like you got worse IBS. Then the IBD is more down at the further end of the spectrum. A lot of people they're losing weight, they're having 17 bloody diarrheas a day, and they're anemic, and they got to go on prednisone, and they're talking biologics, and they're trying to avoid those. Kind of the situation they come into me. And so my point is just there's a lot more urgency to that. If it's like, oh, have urgent problems, we got to put this fire out quickly. But the people with IBS are in a little tougher spot because they're suffering, they're miserable. They're just not to the point of like hospitalization right yet, but they're still suffering on a daily basis. And sometimes that can almost be worse because even to your husband's point, not like we compare miseries, but he was miserable. He's figured it out and solved the problem, and it's been in remission for 7 years. Where a lot of people that are just kind of in the middle of that spectrum, been miserable for the last 7 years, and they've probably been stuck there. What's the role that toxins play with the gut? Because I think that you're gonna say, well, they play a role, but it's a harder one to like, how do we know? And even if you do a urine toxin test, it's like, well, you got aluminum and arsenic and these things, and some come from the food supply, some come from the water supply. I think of mold, and this is all I'll say about mold because we could have an entire conversation about that. But the one thing about mold is that that's a problem that you can do something about. If you're living in mold, you got to get out of it. But what about toxins and their role in the microbiome, their role in intestinal permeability, their role with the gut-brain connection, all those things? But toxins, I think, are toxic, and they're toxic for a reason. But what role do they play in this? And also, too, Dr. Wentz, talk about them with the thyroid too, because they're toxic. So they're toxic to the gut, they're toxic to the thyroid, they're toxic to the brain, but especially the gut first, because that's our topic of conversation for the most part.
Yeah, I mean, there's just so many different toxins out there. Give you an example, let's say glyphosate. So this is a pesticide that's added to our crops. This can significantly alter the gut microbiome, making us more Clostridia predominant and have lower levels of bifidobacteria and lactobacillus bacteria. So that can really produce a dysbiosis. Mold toxicity, I think we mentioned already, can really suppress our immune system in the gut. When you think about, you know, antibiotics like penicillin, they were derived from mold too. And so having mold exposure, and if mold colonizes your gut, it's like being on antibiotics long term, right? That can really mess up your gut microbiome. Medications too. Medications can be very toxic to gut health. I know when I was in pharmacy school, I had to do like 2 exams a week of all kinds of different subjects. And sometimes I just got so tired of studying and I didn't, I'd be like, oh, I don't even know this answer. So we had multiple choice questions every now and then. And I'd be like, okay, if the question is, what side effect does this drug cause? And if there's an answer that talks about gut issues, like I'm just going to choose that answer because it's probably right. Like just so many medications can cause gut issues, specifically one that I feel is very relevant to young women who tend to be the ones that get a lot of IBS diagnoses. Birth control pills, drospirenone containing birth controls specifically have been tied to IBS. They can really cause gut inflammation. And so,
well, and that's the same demographic that's more prone to thyroid things too, but
absolutely. And birth control pills have also been found to affect thyroid conditions. I had this theory when I was first kind of drawing out my map on what can cause issues with IBS and Hashimoto's and all the symptoms I was having, that could play a role. But many years down the road, somebody actually like did the research and studied the connection. It's been kind of cool because I had my weird theories and a lot of them have come true.
um okay, so tell me about thyroid, and not just toxins with thyroid, but how does the thyroid affect the gut? And I would say vice versa, but let me just get that one out of the way. I think we've already talked about the gut can be the gateway to autoimmunity, and autoimmunity being the predominant cause of thyroid conditions in the US especially. So, in being the focus of my whole podcast is like, yeah, the gut is important to the thyroid, but how does it go in the other direction? What role does thyroid hormone have with regards to bile or motility or stomach acid release, and how important is that?
Yeah, it's really interesting. There was a paper published many moons ago, and it was the consequences of dysthyroidism on the viscera of the intestinal tract. So it was talking about like all the things that when you don't have enough thyroid hormone on board, what happens with your digestion. And so a few of the patterns is one of them would be slowed motility, right? We can expect that. So if you're hypothyroid, you're going to be overall sluggish. And so you're likely going to have a sluggish digestion, right? And so you're going to be at risk for things like SIBO. We talked about that already. You're probably going to have constipation too. You might
Because
also
things
have,
are just sitting in there more, so they're more likely to colonize or proliferate or whatever, right?
exactly, and
Yeah.
acid reflux, those are going to be more common. The other things that are going to be more common are going to be low stomach acid. So typically people with hypothyroidism are either going to have no stomach acid or very low levels. And this is something that I find is very, very relevant. I know For me, on my healing journey, when I discovered betaine with pepsin, which supports stomach acid, it was like a awakening for me. I went from sleeping 11 hours a night to like 7 hours a night, and all of a sudden my brain started working again. I used to be very funny. The Hashimoto's diagnosis, it was like my sense of humor and all of my wit and sharpness just disappeared. I was like a very a small percentage of myself, and then that all came back. Um, yeah, definitely bile acid can be impacted. Just really a lot of the digestive tract and thyroid. I think people don't really appreciate the big connection. And it, like you said, it's absolutely a two-way street.
Yeah, well, and stomach acid, I think, makes, I don't want to say it's obvious, but it's like, yeah, it's the stomach. But what do you need to make stomach acid? You need good thyroid production. And I think every cell in your body needs thyroid production just for the metabolic rate. So everything can kind of slow down. So it's almost like I set you up for a hard question because it's like, what could possibly not be affected if you got low thyroid? Everything can slow down. That's why hair, skin, nails, weight, brain fog, constipation. I mean, everything just kind of slows down. So it's like, how would it not affect the gut? It's going to affect everything. Um, Let me ask you about elimination diets or food sensitivity testing. What do you prefer with regards to those? Because we talked about that a little bit, but and also within that, because here's my thing, is like, yeah, we could test and it's never a bad idea. But also like gluten free, grain free, dairy free, going paleo. And then I a lot of times will draw, a little food pyramid or whatever and say the foundation is going to be paleo, but then what else? It might be FODMAPs, it might be histamine. But what are your thoughts with foods and just, eliminating or testing or some combo of both? And the most common triggers that you've found. I mean, you might just say, yeah, exactly what you just said, Taylor, gluten, dairy, eggs. But what are the most common triggers that you've seen?
Well, gluten and dairy are some of the more common food reactions, both in Hashimoto's and IBS. With IBS, it's also been a bit interesting because sometimes raw foods can be a big trigger. So, like lettuce and greens and blueberries, which to me is like those are typically considered healthy foods. So, that was a big surprise to me when I started seeing that in people with digestive issues. Food additives, I think we talked about that. These are going to be very problematic for people. Those osmotic laxatives, as I like to call them,
Yeah,
these are
yeah,
going to
that's
be
an interesting one.
problematic for people. There are people that will react to high histamine foods, high oxalate foods. You can kind of go down the rabbit hole. Some people react to fiber. And I would say for me, if I had $1 million for every person, I would try to do a lot of the different testing, mostly because I'm kind of a nerd and I think it's cool. But also, sometimes a person might present with symptoms and I might not connect that the symptom might be related to something. And there's some people that really take great care of themselves where they're going to be asymptomatic, and I will take, I'll be looking at their lab tests and I'll be like, oh, typically when people have X, Y, and Z on their lab test, they have these symptoms. But, you are somebody that takes this amazing vitamin, or you're somebody that works out 4 days a week for 3 hours a day, or you're somebody that meditates or, does a lot of nervous system work. So you're not going to be anxious where another person might be, right? And so I do like to try to do testing whenever it's available. But I
Or
do
and
appreciate.
and sorry to jump in, but I think that clinically seeing people one on one, it's like, yeah, we're going to test. But sometimes when you're writing a book that thousands of people are going to read, and not everybody has access to that, you got to give them some breadcrumbs to follow, and it might not be everybody jump to testing. It might be try cutting these foods out, and I think that that's also like you can always go deeper if you're not solving your problems. But I'm also a fan of test, don't guess kind of thing. But again, we respect people's budget and things like that too. It's not like test everything under the sun. And you can't always see everything too. But to your point of like somebody that eats well and does a lot of mindfulness and meditation and exercise and things like that, sometimes testing can rule those things or shine a light in the shadows where we can't see. But also, we still might not see everything too. If somebody bloats from a salad, that might not show up on a test. It might be more talking to them and clinically asking them those questions.
Yeah, absolutely. And I do love elimination diets because they can help people put things together, right? For themselves. They can start making those connections.
Yeah. Yeah. So, the last two things I was going to ask about, Dr. Wentz, and I don't even know if we need to say anything, but the two things that were on my mind, because histamine and mast cells are a really center point of my practice. And so histamine can come from foods. And there's certain foods that just straight up have high amounts of histamine or tyramine. And then there's also mucosal mast cells that are very commonly associated with a lot of the symptoms associated with IBS, with abdominal pain, with bloating, and the mucosal mast cells just get active. So that was one. And again, I don't know if I'm asking a very clear question. That was on my radar. And then the other one was the vagus nerve. Those two things I think are just often missing pieces when somebody's done all the probiotics and herbal killers and glutamine powders and whatever. It's like, well, have you addressed either of those two things? So again, I didn't ask a very clear question, but if you have anything to chime in about either of those two things, I'll open the floor to you. But the other thing I was going to say, and let me just get this out and we can wrap it up, but is just tell us more about your book. Tell us more about your book and what's involved in it, and where people can find it, and just what you tried to lay out for people. Because I feel like, and again, I will let you answer in a sec, but I feel like one of the things that I've found with you and your books, and with a lot of other practitioners too, Dr. Wentz, is like we all kind of say the same thing. It's just different ways of getting there. And it's like if we want to go from, here to Denver, there's a lot of roads we could take. They're all going to get there. We want to take the fastest. We want to take the most efficient route, but there's a lot of roads you can take. So I think that you and I just,
Yeah.
if we were
So with
working side
regard
by side
to
in the if we were working side by side in the clinic, we might be doing the exact same things, but there's also a lot of differences. But tell me about mast cells, histamine, vagus nerve, and then a little bit more about your book. But other than that, I agree with everything you've said. So I'll let that be the last question that I ask. But mast cells, histamine, and more about your book. Tell as much as you want.
Okay, thank you so much. Yeah, I'm really glad that you brought up these two things. I feel like they are there's a lot of awareness about them these days, and you probably have a lot of patients seeking you out because that's your specialty. In my experience, I used to think, okay, if you had a food reaction, maybe the food was the problem, and we wanted to be on an elimination diet long term. And I've kind of gone into this kind of a shift in the last maybe no, probably 10 years, where I'm more as like, okay, well, why are you having histamine issues? And is bone broth truly that evil, right? Are avocados evil? Are strawberries evil? And the conclusion I've come to is like, no, these foods are not evil. What is going on in your digestive tract? What is going on with your metabolism? And why you're not properly breaking these things down. And so for histamine issues, I would be thinking of, do you have SIBO? Do you have different protozoa because they produce histamines? Do you have mold exposure? Because that can really turn on a lot of the mast cell things, right? And so I would be thinking about these things rather than like a low histamine diet long term. And I would also be thinking about like, how are we breaking down histamines? Are you utilizing the DAO enzymes? Can we do I use P5P for everything because that helps with histamine breakdown. And then sometimes I'll use like methionine and or SAMe because that can help with that histamine pathway. And we're trying to figure it out that way, right? Rather than being like, just don't eat anything, right? Just
Right.
have these
Yeah.
ice cubes. So that would be my approach to that. I do detail that in the book. Also, how to get rid of oxalate sensitivity, how to get rid of salicylate sensitivity, how to get rid of, all these different food sensitivities that I've come across that I'm aware of, like how to clear sulfur issues and dairy issues. Because I feel like, the goal for people is to have a varied diet and not to be on a super restricted diet long term. And then with the vagus nerve, I feel like this is something really important for, especially for, anxiety, slowed motility. And sometimes I might recommend supporting with like thiamine or choline or riboflavin to help that vagus nerve function, just to see if that might be a supportive method for people. And I do have that. I have a hypomotility, and we talk about the vagus nerve in that chapter as well.
Okay. Yeah. Then tell us more about the book, and that'll be my last question. But tell us more about the book. Tell us where people could find it. You got it right there. I'm super excited for it. And so yeah, tell us more about it. And I think it is a huge need. So kudos to you for doing it. And yeah, just gut issues. And again, sorry to ramble, but you read a book about Alzheimer's, it's gonna be like gut. You read a book about thyroid, it's gonna be like gut. You read a book about cancer, it's gonna be like gut health. You diabetes, gut health is so central to everything. So I do think it's a centerpiece for a lot of these conditions. So I think it's great that you're getting the info out there, but tell us more about the book itself.
Definitely. It is Finding and Treating the Root Cause of Irritable Bowel Syndrome. It's available on Amazon, Barnes& and Noble, wherever fine books are sold. I do have some pre-order bonuses. So if you pre-order this book, you go to thyroidpharmacist.com/IBS. I actually have the inflammatory bowel disease chapter available for people to get ahead of time. And then I also have a food sensitivity guide on how to overcome, histamine, oxalate, dairy, sulfur reactions, whole bunch of food sensitivities, how to clear them. This book it's 500 pages. It was like 1,000 pages. It was supposed to come out last year, but my publisher said I needed to cut it in half. And so I've covered a lot of different root causes of digestive issues and IBS. And I will say not everybody is going to have every root cause. So not everything is going to be relevant to every person. But the information's out there. So if you're going through the book, you're figuring out your root causes, triggers, your symptoms, we're going to cover that in the book. So it's broken down by different chapters per cause. And then at the end, there's also a section on how to figure out symptom solutions. So like we talked about, if you're constipated, magnesium citrate might be something really helpful. If you have diarrhea, something like zinc and L-glutamine and Saccharomyces boulardii might help you turn those symptoms around rather quickly. So I'm hoping that it'll be a guide for practitioners and patients to use to really heal a ton of guts, get rid of a lot of IBS, get rid of a lot of IBD, and hopefully prevent a whole host of autoimmunity and thyroid disease. And we didn't talk about fertility challenges, but definitely
Yeah.
fertility challenges can also be associated with IBS and thyroid dysfunction.
Yeah. All right, just to wrap things up, I think that, again, we're in complete agreement that the digestive system works north to south, and the whole thing's got to be clicking for it to work properly. You got to have stomach acid, you got to have bile, you got to have enzymes, and then we've got this microbiome of all these, 10 pounds of bacteria, and we need balance. Now, that's again very broad statement, but how do you know if you have imbalance? Well, you got to test sometimes and see what the imbalances are. If you have symptoms, then you go and look for these solutions. So I think that, to your point, the book is a roadmap, but instead of saying here, start here and end here, it's a lot more like, well, what are you dealing with? And if you got diarrhea, don't read the constipation section. And obviously read the book cover to cover, but it's more, what do you have? And this is how you address that. If you've got slow motility, if you've got candida, if you've got SIBO, if you've got these kind of sensitivities, because I think that's what we see in practice is hey, the gut's important. But your gut's different than my gut's different than his gut's different than her gut. So what do we all have to do? It's not always the same thing. And that's what your book lays out is all those different nuanced approaches for each person. And it sounds like it's got to be a coverall for about everybody. But each person's going to get different, value out of different chapters and things like that. So that sounds awesome. I can't wait to check it out.
Thank you so much.
Absolutely. You got anything else to say? Otherwise, thank you so much for coming on, Dr. Izabella Wentz. Everybody check out the book. We'll put the link in the show notes. But otherwise, thank you for coming on. And yeah, it's a pleasure talking to you.
Thank you so much for having me and for the work that you do and for helping so many people with autoimmunity. I really appreciate you and your work.
Well, thank you. I appreciate that. So awesome. All right. Stay tuned next time, guys. We'll talk next time. See you later.